Unmute Pat.
Perfect. Good morning, Mr. Mayor. How are you?
Good morning. How are you? Adam, good to see
Great.
you.
Thank you. Okay, super. Good morning, everyone. This is Adam Mayberry with the Joint Information Center that's been responding to the COVID-19 pandemic here in Washoe County. This is our Friday virtual presser that we've been doing. Happy Friday, everybody. It's good to see you all. We have some special guests today. We will not have an update from health, although we did just get our regional message out to all of you that you should be in your boxes by now. If not, we'll be here in short order. I can tell you, unfortunately, we do have 2 additional COVID-related deaths today, both females, one in their 60s, one in their 40s. And there's some other data in that release as well. I believe that puts us at 32 COVID-related deaths in Washoe County. We'll resume our health update on Monday, but today we're going to hear from our 3 elected leaders. We have with us Sparks Mayor Ron Smith, Reno Vice Mayor Devin Reese, and Washoe County Chairman Bob Lucy, that will be sharing their reaction to the governor's announcement yesterday, what their governments are doing to align and to begin to reopen their respective local economies. I know there'll be a lot of questions. We have 30 minutes, we may go a little bit beyond that. I'd like to utilize chat a little bit more for this particular venue, so people aren't talking over one another. So if you're in a position to send me your name, you don't have to tell me what your question is, just send via chat that you have a question and I'll announce your name. If you don't have access to a laptop and you're participating via phone, if you can just wait toward the end, and I'll ask those that may just have audio to ask their questions. But I'm hopeful that today we could just use chat. Again, just send me your name. I know who most of you are with. If I don't, I'll ask you to identify what organization you're with, and you can ask your question. So, but with that, we do have some opening comments from all 3, and we'll begin with Sparks Mayor Ron Smith. Good morning, Mr. Mayor.
Good morning. Can you hear me?
We can hear you, and we can hear and see you. Thank you.
Okay, good deal. Thanks for having me here today. You know, we understand that our communities are frustrated. So are we. This has been hard on all of us. We are extremely proud that Sparks, Reno, and the county have worked together on our regional approach to business operations. Also, getting businesses essential and non-essential open and people back to work is our biggest priority. We appreciate each and every business and know that they have that they have made extreme sacrifices during this pandemic. We are pleased the governor has adopted the common sense curbside commerce program we've been using in Washoe County. This means any retail business that can safely do business curbside is welcome to do so. We are working together to safely open back up. We are working together to safely open back up these businesses while continuing to follow directives set forth by the governor. It is important that we follow all directives for the next 2 weeks so we can open up on May the 15th. Please practice social distancing, wear masks, stay at home, and practice good health activities. The sooner we do this, the sooner we can safely get back to our new normal. Thank you, Adam.
Thank you, Mr. Mayor. Vice Mayor Reese, good morning.
Thank you, Adam, and good morning. Thank you for allowing me to spend some time with you again. I want to just thank everyone in the community for their well wishes for me. As many of you know, I went through the COVID testing protocol this week through the health department, and fortunately yesterday I found out that I was negative. You know, the truth is that many families have found out that they're positive, and we've got 32 folks who have, unfortunately, in our community lost their lives. So those are the more important things as how we recover. I'm certainly honored that Chairman Lucy and Mayor Smith and the city of Reno have really worked very closely with one another. And I think they'll continue to do that as we move into the next phase. We have some great folks who are exhibiting tremendous leadership here in Northern Nevada. And I just couldn't be any more proud to be a part of such a group. And I thank them for their leadership. You know, we've got some tough days ahead of us still, but I think we're on the right path. So thank you so much this morning, Adam, and I'm available for questions.
Thank you, Vice Mayor Reese. Good morning, Chair Lucy.
You got it.
All right, good morning, everybody. I apologize. Thank you for everybody joining us this morning. As many of you heard last night, during the governor's talk, he had brought forward a plan, which he's calling Nevada United, Road to Recovery. We were happy that he approached this plan from the standpoint of getting the state back on and addressing this ever-growing pandemic within our state in a very positive approach. And we're happy that he's including the cities and the counties in that discussion. And we're happy to participate in that discussion. And as Vice Mayor Reese pointed out, and also Mayor Smith, we've had a tremendous working relationship with the two local entities here. And we're going to continue to work with them as we move forward and reopen under the phased approach that the governor had presented to us last night. You know, obviously, the counties, as the governor stated, will be taking the lead, but we will be taking information from everybody. And with the health district and some information provided to us, every county is going to look different, but I can assure you, I have been working with my counterparts in Clark County, Chairwoman Kirkpatrick, and my counterparts from across the state to address this that have been identified, and what the governor called the LEAP team last night, the local empowerment advisory panel. And that was comprised of the Chairwoman Kirkpatrick from Clark County to represent the urban counties. It was represented by J.J. Gokachia. He is the chairman from Eureka County to represent the rurals. Executive Director Dagny Stapleton from the Nevada Association of Counties. And then Betsy Fretwell from the state, and Michael Brown from the state. So those will be working directly with the governor's medical advisory team to address any of those concerns as we move forward. But I will continue to share with you momentarily about what we're doing on testing, and I appreciate the opportunity to be here this morning. Thanks, Adam.
Thank you, Mr. Chairman. I do have some questions that are rolling in, and I'm going to kind of let the three of you maybe work amongst yourselves, and I'll help to maybe address some of those. But Bill Denser was the first up to bat with the Review Journal in Las Vegas. Bill, you with us?
Thanks, Adam. Yeah, I'm here. First, I want to just be clear. So we don't have anyone on the call who can speak today to the specifically to the new case numbers. Is that right?
I do not believe we do, but we'll be happy to follow up with any questions specific to the data that we have today. We wanted to devote really most of the attention with our three elected leaders and really talk about what we're doing at the local level to help reopen and restart the economy.
Okay,
And-
yeah, that's right. I just wanted to be clear before I ask my other question. So
Okay,
this
thank
is
you.
this is for Chairman Lucy. I wanted to go back and see if we can revisit the commission's vote on April 21st on the amicus brief in the osteopath's suit on hydroxychloroquine use. And since that vote, there have been some additional studies. The FDA has pulled back and asked that drug's use be limited to clinical and trials. So I'm wondering if you still stand by that decision by the county commission that was the right call to support that suit, and whether you might be changing your feelings based on additional medical evidence.
Bill, thank you for that question. I appreciate that. Obviously at the time, the discussion that was brought up amongst the county commission was to obviously look after the public safety and the health and wellness of our community. It was never really ever about hydroxychloroquine or the drug itself. It was about trying to allow for the continued connection between the doctor and their patient, and what that relationship was for the overall public safety. Now, obviously, in the last couple of weeks, we've seen some different things with the new drug remdesivir that they're seeing some benefits from. I have called for a special meeting of the county commission to take place next week to take a reconsideration of removing our support of the amicus brief and the NOMA's law case that they have filed. And so we will be reconsidering that and bringing that in front of the board next week in a special board meeting.
Oh, thank you.
Do you have any other questions, Bill?
No, Adam, thank you.
Okay, thank you. We're going to go to Riley Schneider with the Nevada Independent. Again, if you have questions, please just send me a message via chat if you can, and we'll get you in the queue for our elected leaders. Good morning, Riley. Go ahead.
Hey guys, thanks for having me on the call. Can you hear me okay?
We can. Thank you.
Okay, great. Wanted to ask, coming out of the governor's announcement last night about the road to recovery and that whole roadmap, there was some concern expressed by the mayor of the city of Las Vegas to the Las Vegas Review-Journal. Sorry, a motorcycle just drove by, that's why it's very loud. Some concern expressed by the mayor of the city of Las Vegas about cities not being included in the order. So I'm just wondering if the three of you, or maybe Chairman Lucy, can kind of go over what role you see cities playing in kind of the county-driven reopening, and kind of what to expect in the next week about how Washoe County is going to deal with the ability to reopen.
Riley, I'm going to ask the Mayor Smith and Vice Mayor Reese to help me with this. Obviously Las Vegas is very much different than it is here in Reno-Sparks. Las Vegas being that they have a number of multiple cities involved in Clark County, and that the Strip is directly located within the county boundaries. There is a much different dynamic down there. Here in Reno and Sparks, we work cohesively together continuously on our incident command and how we approach that. And so we don't see the same time. Mayor Goodman has a much different outlook on this than we do here. We have been collectively working together with Mayor Smith, Vice Mayor Reese, Mayor Sheevy, both councils, to really address every concern that we see forthcoming for the last 6 weeks. This has not been a challenge between us, and I don't see it being a challenge going forward. And I look to their guidance because, as you know, here in Reno, a good majority of our casinos are located within the city of Reno. We have also casinos that are located within the city of Sparks. And so we have to write all of our policies and directives as we move forward through this recovery map together. And that's the only way we can do this cohesively, and not just as Reno, Sparks, Washoe County, but we're going to work with all of Northern Nevada counties and cities to address these concerns on a really more of a global scale. So I'll turn it over to Vice Mayor Reese.
Thanks, Chairman Lucy. You've said it exactly. Our region is blessed to have good leadership, and we have been working every day, even when people don't see it. There's a lot of work that goes into the things that are happening, and so we have had great conversations. I know that this afternoon, Mayor Sheevy and Commissioner Lucy will have a press conference where they'll talk about some of the ways that we are going to move forward. I think it's going to be awesome, and I just know that we have a unique role to play together with one another. And we serve on so many boards together, whether it's TUMWA or the regional planning. We all really do know each other well, and there's a great deal of respect for each other. So I'm excited about it.
Mayor Smith, do you want to add some commentary to that?
Okay, we'll give him a few minutes. I don't see anything in the chat for any further questions. Please, if this is a wonderful opportunity to ask some questions. So if please.
Adam, can you hear me?
Yes, go ahead. Go ahead. Thank you, Mr. Mayor.
Okay, I'm sorry. I thought I didn't unmute myself, but I've been elected since 2006, and I can't remember a time, even during the recession, that we didn't work together. We call each other, and like Vice Mayor Reese says, we're on so many boards and commissions together. We talk, if not daily, weekly for sure. So I think moving forward, good times or bad, we work together and we figure it out together. We like to think regionally instead of the city of Sparks, the city of Reno, and we've been able to do that. You know that, Adam. We've been able to do that over the years, and it's paid off for us.
Thank you. Any questions for Mayor Smith, Chairman Lucy, Vice Mayor Reese?
This is Riley again from the Nevada Independent. Just wanted to kind of follow up on that question and just, I think I know the answer to this, but there's no plan to have different restrictions or loosening of restrictions in place based on jurisdiction. Whatever the county does will be countywide, right? Like there won't be any different rules in Sparks versus Reno versus the county?
No, at this time, what we're going to do is we're going to work together and draft all those policies cohesively so that they are functional for all three entities. And that is going to be one that was one of the directives from the governor, but that's how we operate, Riley, and we've not seen it any way else to work that way.
Thank you. I do have a question from Bree Zender. Bree, it looks like you're with KUNR. Yes, Bree, go ahead.
Yep, that's me. So I'm curious, are counties and the cities across the state working with the state themselves in order to figure out when city and county offices should open up?
Our offices in Sparks have been open.
Oh, that's right. Okay.
And Bree, so obviously here at the county, we've put in some individuals on home or working from home, and they're working remotely. But all of our departments are still working and functionally, and it has changed the way we've been continued to work. Obviously, the county's approach for our 2,800 employees has changed over the last 6 weeks, but we're making sure that we're trying to work through, proper separation for those individuals. Obviously the social distancing, no longer the massive groups of meetings. We're trying to do most of that stuff remotely, as many of you people know. And so we're working to kind of maintain that. And obviously it's budget season for all three entities. We have budgets that are going to be due for all three that are due to the state. And so we continue to work. The government has been an essential business. That was deemed long ago that we continue. So look, we're working around the clock. And I think as we continue to build those phased plans to approach the governor's road to recovery, that's really going to be necessary. So no, we haven't never closed our offices.
Sure.
The structure.
Yeah, I think I maybe should have phrased that differently. I meant kind of as, coming together and operating within the same buildings.
Hi, this is Denise from Channel 8. I have unless Ron Smith was going to talk, I have a question for Chair Lucy.
Go ahead.
Okay. I guess my question is, with Sisolak being the former chair of the commission, so this is for Chair Lucy. He was the chair in Clark County. Him saying that county governments have more responsibility now. This is something that is uniquely Nevadan. He believes that counties understand their government more. How do you feel about that? About counties and local government getting this special role to enforce, make special decisions on how and when things can reopen, bringing that down to this regional level?
Okay, so I think the way I'll address that is that, look, yes, Governor Sisolak was the chair of the Clark County Commission, and they did have, like I mentioned to Riley previously, Las Vegas is a very much unique area. Clark County has integrated itself in between multiple cities. They have to work together all the time. Here in Washoe County, it's been a different structure all along. Obviously, the unincorporated area surrounds the cities, and we work cohesively together. But I will say that both the cities and the counties do play different roles within our own jurisdictions. The cities do have their police security that they have to maintain, their parks and recreation, and the safety that they maintain through their business licenses. But we have obviously we have a joint local jurisdiction agreement for our health district, and we all participate in our health district equally. Also, we operate jointly through the Regional Emergency Operations Center to deal with emergencies like this. So we take different roles when it comes to county levels, and I think maybe the governor's understanding from a county level is a little bit more broader, and maybe it's from his aspect that 17 counties might be easier to manage than 130 cities. Or 130 members within the community. So there might be a difference there, but here in Washoe County, I don't see it being an issue, being that as Mayor Smith pointed out, we have always worked regionally and will continue to do so.
Thank you, Chair. We are going to go to Anjanette Damon with the Reno Gazette-Journal. Good morning, Anjanette. And again, if everybody could submit if you want to ask a question, please let me know via chat. Go ahead, Anjanette.
Good morning. Thanks so much for answering some of our questions. This is for Chairman Lucy, but happy to have Councilman Reese and Mayor Smith jump in too. And it's kind of a two-part question. One, do you have any concerns about the resignation of Dr. Todd from the Health District, the head of epidemiology in the middle of this pandemic? He was someone with a great deal of expertise. And two, are you satisfied with the progress that the district is making on increasing testing capacity?
So, Anjanette, thanks. It's always good to see you. Thanks for joining this morning. I appreciate it. Yeah, obviously, Dr. Todd's departure was unique in the midst of a pandemic. I can't speak to why the health district officer, Mr. Dick, decided to make that decision. I do know that they do have a good staff of epidemiologists on board over at the health district right now. So I do feel still we are getting a wealth of information from those epidemiologists and have great support from those individuals. But I can't speak to the reason why or what that does. I don't feel that it has impacted our ability to respond to the pandemic. In regards to testing and how we continue to move forward, we're ramping that up every day. I have had multiple conversations with Dr. Pandori at the state lab and Kevin Dick, and then also our incident commander, Sam Hicks, on how we run our posts and what we're going to be able to do and how many individuals we're going to be able to ramp up. And as we move into different types of testing, as we go into larger phases that the governor asked, more asymptomatic testing, we have plans in place to do that we worked in conjunction with Reno Fire, Sparks Fire, both police departments, the sheriff's office, REMSA, and all of our first responders to really approach this from a massive scale to get sure that we get that testing number and bring some of that understanding online for the entire community. Hopefully that answered everything for you, Anjanette.
Okay. Thank you. Thanks, Anjanette. We're going to go to Lucia Starbuck with This is Reno. Good morning, Lucia.
Hey, it's Lucia, but this is a question. It's okay. This is a question for Chairman Lucy. Can you kind of explain what LEAP is and kind of how it's going to help and what that's going to look like?
Okay, so last night during Lucia, thank you for appreciate that. LEAP is what is, I guess the acronym is the Local Empowerment Advisory Panel. That's been comprised of 5 members. That's Marilyn Kirkpatrick, Chairwoman Marilyn Kirkpatrick, representing the urban communities from Clark County. Chairman JJ Gokachia from Eureka County, who is representing a number of the rurals, who is also the state veterinarian and knows very much the state role. You've got Dagny Stapleton, who is the executive director of the Nevada Association of Counties, who works directly with the Nevada League of Cities, and they'll have some input there. And then also we have Betsy Fretwell from the state, and Michael Brown, who is the head of the Governor's Office of Economic Development. Those 5 individuals will convene and make sure that they are adhering to the checklist that's been provided to every county from the governor's office to fulfill the requirements to move forward with us, to move into phase 1. Because as the governor stated last night, to move into phase 1, he is adamant that we move it to a phase 1 as a state. And that is going to make sure that all 17 counties move together. And when we say 17 counties, we mean all the cities in between. And I think it's a management choice on the governor's decision to move that way. And realize the LEAP team or the local empowerment advisory panel will also have to convene with the governor's medical advisory team that's been comprised of 5 medical professionals from around the state as well, to make sure that their directives and all the checklists and stats have been met by all county before we move into phase 1.
Got it. So their job is kind of just monitoring?
It's not monitoring. It's more of an organizational management team to make sure that all the counties are adhering to the checklist and making sure that they have the necessary requirements for PPE, personal protection equipment for all the governments, what their surge capacity would be for testing if a spike were to happen in any community, what their hospitalization levels are, what their ability is to continue to test either symptomatic or asymptomatically as we move through the process. What is their ability to do contact tracing for individuals that may have come in contact with a positive case of COVID, and how we go back and try to isolate so we can, once again, flatten the curve and minimize the impact to our healthcare community and our hospitals.
Thank you, Mr. Chairman. I'm going to have 3 reporters here on the lineup, and then I'm going to have a representative from the health district just address the increase in COVID-related cases that we issued today. So in this order, we'll hear from Bill with the Las Vegas Review-Journal, followed by Riley with the Nevada Independent again, and Marcella Corona with the RGJ, in that order. So go ahead, Bill.
Thanks, Adam. So you just said there will be someone from the health district on the numbers. That was my question, and I'll state it anyway, and perhaps we can get some reaction from the elected officials. But yeah, the 48 cases today is the largest the Washoe County has seen throughout this period. And, we look forward to hearing from the district about whether that's because of an increase in cases or whether there's been an outbreak. I assume they will address that. But for the electeds, I'm wondering if when you saw those numbers, what kind of reaction did you have for that? And in your communities, do you feel that people are doing the best they can to maintain the social distancing requirements? And are you interpreting that number as perhaps something that's really needs to mean we need to step things up?
Ron, do you want to go? Mayor Smith, you want to take a stab at that?
Sure. Can you hear me?
Mm-hmm. Yep.
Okay.
Go ahead.
Looking around, I think there's a lot of responsible people out there. They're wearing masks. They're keeping their distance from other people, unless it's a family member. They're getting frustrated with being locked away at home, but I think they're standing up to the plate. I think they're doing it. I don't see there's going to be bad actors. What you do, they don't need to do it. It doesn't affect them. I think overall that I'm proud of the way the citizens of Sparks and Washoe County have reacted. It's encouraging to see that we beat this thing back and we get open on the 15th. The next 2 weeks are very important to all of us.
Yeah, and Vice Mayor Reese, do you have some comments for them, maybe really quick?
Sure, just ever so quickly. I think number one, we've got to pay very close attention to the epidemiological evidence and be monitoring it. When you see a jump, I think I will defer to the medical folks about what it means. Anecdotally, I know that as we ramp up testing and people like me who were reluctant to be tested earlier, or maybe thought that they shouldn't be tested earlier because they didn't want to take a test from a first line responder or from someone in a high risk group, are coming out and saying, well, do I have this? And so that increase in numbers is going to result in more people, I imagine, identifying and becoming known to be positive. So I think it's a matter of, as we ramp up our increase in testing, we're going to see some increase in those numbers. I don't think that that means we're going the wrong direction. It just means the more data is available.
That's right. Chairman Lucy, you want to comment on that, and then we'll go on to Riley?
So I would agree with Vice Mayor Reese. I think that both mayors are correct. You know, we're going to see days like this as we continue through this pandemic. As we continue to ramp up testing, as our post sees more individuals come through, as we continue to do more of these command posts, you're going to get more positives. It's just how it's going to be. But it's really what we need to discuss is the direct correlation between our positive cases that are going to be presented and as many negatives that we get as well. We've currently tested to 10,000 individuals, which almost represents about 1% of a population here that we could get. And so we're trying to figure out, or no, 2%, I'm sorry, 2% of our total population here in Washoe County. And as we continue to look at those cases and we continue to test through, you're going to get positives. It's about how much of our recoveries are coming along, how many of those individuals we're going to see, and you're going to see spikes. This is not going to go away anytime soon, but you know, it's really based around the expanded testing that we've been working on.
Riley, you have a question?
Yeah, hey guys. So looking at the governor's outline and kind of criteria for the phase 1 reopening, it's interesting in how they're giving county governments the ability to kind of run point on this, but then there's also limitations saying that counties can't go basically below whatever the state has ordered. So I was just wondering, do you guys have kind of any idea in mind at this point, knowing that these just came out last night, what the county can actually do that would be different from maybe other counties or from statewide guidelines, given that you can't loosen restrictions faster than what the state is calling for?
So Riley, thanks for the question. You know, Chairwoman Kirkpatrick and myself have been working back and forth and communicating with each other almost daily for the last 4 or 5 weeks, and consistently working on plans as it pertains to Clark County and Washoe County. Now, we understand every geographic is very much different, and I think when the governor decided to put counties at lead, it was not to disenfranchise the city's discussion or ability to discuss things. It's just that some counties in the rurals may not be represented very strongly by a city council, and a majority of the services may come from the counties in those rural areas. And as you heard last night, the governor was adamant that we bring the state together as a whole to phase 1. And when we move into those phases, yes, we're working diligently to find how it meet what those requirements and checklists are going to meet for Washoe County, and they're going to be very much different for us than they are for Clark County. But once we get to that phase 1, once we understand what we need to do, which comes around testing, contact tracing, the availability of PPE, and continued efforts to plan and work with the state, I think that's really the first step, getting into phase 1. Once we get to phase 1, it will be at the discretion of each individual county to understand how they can move into phase 2 and 3 through directives from the state, and directly from the cities and the counties will all play a major decision in that.
Very good. Thank you. Thank you, Mr. Chairman. Let's go to Marcella Corona with Reno Gazette-Journal.
Hi, Adam. Thank you. I know people have been asking about the spike in cases. I don't know if anyone there can answer, but I'm just wondering, we're talking about like an increase in testing, but I'm wondering if there's any indication that the spike could be tied to any of the protests or social gatherings that have been going on in recent weeks. I don't know who could speak on that, but
I think that's a better question for the health district officers. They would be able to handle that better for you, Marcella.
Well, and that's probably a good segue. For our elected leaders could just stand by for any follow-up questions. I'm going to introduce Heather Kerwin. For those that were on our call earlier this week, you might have remembered Heather kind of explaining the contact tracing process for the health district. I'm going to mangle her title, so I'm going to allow her to reintroduce herself. But Heather, there's a lot of interest in the increase in the cases today, so we've asked Heather to address that. Go ahead.
Sure. Hello. Thank you, Adam. This is Heather Kerwin, a senior epidemiologist and epidemiology program manager for Washoe County Health District. The increase in cases is again related to that Easter weekend. It usually takes, you have a 14-day incubation period. Many people do start exhibiting symptoms sometime between days 3 and 5 after being exposed. But a lot of people that first week of illness feels just kind of like allergies or a little bit of a cold. And it's not until days 7 or through 9 after onset that people really start to experience more of those severe symptoms. The cough deepens, the fevers may come on. And so I think what we're seeing is still a little bit of a ripple effect from Easter gatherings. And then just in terms of the numbers, there are a few smaller clusters. We definitely are still seeing household spread occurring. So it's really important that we continue to have those household contacts distance from one another from sick persons within their own household, and those household contacts do not continue to go to work as soon as someone in their house has become identified as positive with COVID-19. We also, just anecdotally, I had the opportunity to take an afternoon off, or at least out of the office, and I had to go to a couple different grocery stores, pick up prescriptions, and very few people were actually wearing masks in the stores aside from the people who work there. And we do know that specifically in grocery stores, those staff are very vulnerable. But, to me, people who refuse to wear a mask in public or just don't wear masks in public, it's a proxy for how seriously or not seriously people are taking this, whether or not you believe in the fashion of the mask or the effectiveness of the mask. It really is a group effort, and this only works to flatten the curve if everybody participates. So we do know that there are certain occupations that are essential workers are still driving some of these infections in the workplace, and then unfortunately bringing it home to their families. We just know, and locally here at the health district, we haven't necessarily increased our testing numbers yet. We actually had a little bit of a decline in the last 3 posts. Today, I believe we're back up over 200 symptomatic persons being tested again. But we do see an increased number in people who are being diagnosed at time of hospitalization, which is concerning because it means that they've waited so long and gotten so severely ill that they're now requiring hospitalization. And, we are going to continue. There's 3 waves, right? There's usually the first wave, which is the case count, and then the hospitalization count, and then the death count. So that is continuing the trend here. And I think just as the weather opens up and nationally we continue to talk about different states alleviating their stay at home, this is going to continue to happen.
Thank you very much, Heather. Please stand by. I do want to get Riley on the line, some clarity from for Chairman Lucy. Riley, go ahead and ask a question, and then we'll open up for Heather.
Yeah, thanks, Adam, for letting me ask a follow-up. So just want to make sure I'm understanding this correctly, Chair Lucy, that you're saying that individual counties, once everyone is in this phase 1 stage, could move to phase 2 or phase 3, depending on testing PPE availability at different rates in other counties. So like Esmeralda could be in phase 3 while Nye's in phase 1. Is that correct, what you were trying to say?
So Riley, just for clarification, as we move to phase 1 and we open up businesses to the community and start getting that socialization, I think what you heard just from Heather Carwin, from our epidemiologist from the district, as we move up, we're going to see spikes, and we want to see if we can be able to sustain and flatten those curves. Now that's going to be different in every other county, and I think what I meant is to move to phases 2 and 3. It's going to be a discussion with the state and that county about how each county was responding to that 14-day incubation period. As the governor pointed out last night, he wasn't even going to discuss opening bars or casinos until 14 days after we got to phase 1. And I think that discussion is going to come and directly correlate with each county about how they are responding to some socialization again, what's going to happen in their county. Are they seeing surges? Are they seeing spikes to their hospitalizations? I think those are the discussions that are going to happen from each county with the state. I think that was one of the big reasons why the LEAP team was created, to jointly have those discussions alongside of the medical advisory team, so that they can each individually work with the state to decide whether or not they're ready to move to that next phase.
Does that help, Riley?
Yes, it does. Thank you for letting me ask that follow-up.
Thank you. I do have Kevin Dick, the health officer, on the line as well. I think he wants to follow up on some of Heather's comments. Go ahead, sir.
Yes, thank you, Adam. I just wanted to comment on the increased number of cases that we're seeing, and some of the reasons that Heather provided for you. I think this is a reminder as well of the role and responsibility of each individual in our community that they have to help us to move forward in reopening our economy. Because it's only by everybody remaining vigilant and working hard and doing their part to prevent the spread of COVID-19 that we're going to be able to have our cases low and the opportunity to begin reopening our economy. And as we're reopening and we're relaxing some of the requirements for stay at home, then it becomes even more important that everybody be doing their part and being vigilant to prevent us from having another surge into the future. And so I think some people have seen that we've hit the peak, that we're plateauing, we've flattened the curve, and they may be relaxing their behaviors, thinking that we've avoided this terrible situation we thought we might have with the overload of our hospital capacity. But now is not the time to relax, and there's not a time anywhere in our near future that we can see that we can relax the efforts that we're making individually to practice the social distancing, the hand washing, the hygiene. All of those practices remain very, very important if we're going to be successful in working together as the great community that we are to get our businesses back open and to do that in a way where we're not hurting each other and spreading the disease, but working together to continue to suppress and prevent the spread of the disease. So, thank you,
Kevin. I'm sorry. Go ahead, Mr. Chairman.
Yeah, and I wanted to follow up with that. Kevin's absolutely correct. I mean, these relaxed conditions, and going back to what Riley, I had the conversation with Riley, as to move in these stages, we're going to have to show how we can be vigilant without a directive giving us to be to make sure we're wearing our face coverings, washing our hands, participating in social distancing. Those are going to be the predications of how we move forward into phase 2 and 3. And it's going to, and the governor and the MAT team and the LEAP team are going to evaluate each county on their ability to self-regulate, their ability to protect themselves and keep their flattened curve as we move through this. We know we're going to continue to see positives. It's how we see those positives and how we impact each other as we move through this. And we're going into the summertime, and that's going to be a challenge, but we want to make sure that we're still not just saying, relax completely and go full bore. What we're asking people is to be cognizant that there are still needs for you to protect yourself and those around you.
Thank you, Mr. Chairman. I have had multiple questions specific to today's increase, and this is directed to health. Want to make sure that the increase wasn't one from a particular gathering or a cluster, anything identifiable. Can somebody from health address that? I believe I know the answer, but rather have, go ahead.
This is Heather. Kevin, you want me to go ahead and touch on that?
Yeah, please. Thank you.
Okay. So it's not from one gathering specifically. This is people who are not, it's primarily family gatherings. So, family is family, but that doesn't necessarily mean that they're in your household. So we've definitely seen it spread from one family household to a different family household through those kind of gatherings. And then people, again, at work. and maybe loosening up on their hand hygiene if they can't necessarily track down a person that they came into contact with who was actively ill at the time. So it's a lot of little gatherings, and then it, larger households becoming all coming down with it as well.
Thank you, Heather. We'll have one more question from Lucy with this is Reno. Go ahead.
Hi, this is a question for Heather. Can you explain since the last time you came on Monday, how much contact tracing has expanded and how many people you have on now that the National Guard joined this week, and have those numbers of contact tracers changed at all?
Yes, so we have actually been onboarding quite a number of staff. We have with us in our epidemiology program now 15 National Guard. And I want to say approximately 20 to 25 investigators who are helping with the initial investigation and then the subsequent contact tracing. There is a long onboarding process. Unfortunately, there's a lot of data systems, databases, and different drives that they need to be able to access to fully be operational in those positions. So we are rapidly turning those around, and the state is working with us as well to permit access to those databases. And then, of course, because there's the need for a basic understanding of biology and virology with this, to be able to speak proficiently to cases when they have questions, as well as their contacts who may have just all sorts of burning questions when you pick up the phone and let them know they've either tested positive or have been exposed to someone who's positive, that we're making sure that people are able to provide accurate and reliable, up-to-date information. And so we're working to have everybody who's new be shadowing and then be shadowed while they do their first investigations before we cut them loose. So there's a bit of a delay. We get the numbers of people coming forth and helping us, but it can be a bit of a training process, up to 2 weeks or more.
Thank you, Heather.
Thank you.
I'd like to conclude by allowing our elected leaders to have the final say with any follow-up comments that they might like to issue. We'll start with the Mayor of Sparks. Mayor Smith, are you with us?
I am. Can you hear me?
We sure can. Go ahead. Any final
Okay.
thoughts?
Well, I know how anxious we all are. Everybody. My wife drives me crazy every day saying she's got to get outside. And you just got to do it safely. We want to get through this. We've worked really hard to get to this point. And I don't want to see it because of big gatherings or anything like that. Fall back where we have to start over or start in the middle again. We just don't want that. We want everybody to be safe. I know the weather is turning nice. I've been out in the backyard working. But just be careful out there. We'll get through this. And next 2 weeks is very important to us, because then we can start opening our businesses on May 15th, which is very important. I get calls every day. The businesses need to open. They're going under. I get that. And I don't like it. So they want to know why aren't we doing more? And we're doing what we can as far as the city and counties is concerned. So thanks for having this today. I appreciate it. Good questions. And hopefully in 2 weeks, we'll be seeing our businesses open and people going back to work.
Thank you, Mayor Smith. Vice Mayor Devin Reese with the City of Reno. Are you with us, sir?
I am. Thank you. And again, thanks for all the important questions. As you can tell, a lot of the questions that we have are the same, right? We live here. We understand the impact that this has had on people's lives. I think Kevin Dick said it best. This is the time to be vigilant, not to let our guard down, and to understand that we are continuing to fight an invisible enemy. And so I'm encouraged by our numbers, but I just want to make sure that everyone continues to observe and quite frankly, that people go out of their way to observe the social distancing rules. Wearing masks in public is certainly part of that. And sometimes those societal norms take a while to take hold. But all of those things will be important as we move it in the next phase, and we'll be working in the service of this community for sure. Make sure you tune in this afternoon. Chairman Lucy and Mayor Sheevy will be having a press conference, and I know that some of the information that they contained there will be different than what's contained here and is important about our next steps in this process. I'm excited to hear what they have to say. You should be too.
Thank you, Mr. Vice Mayor. Appreciate you coming on. Chairman Lucy.
Thanks, Adam. First of all, I want to thank Mayor Smith and Vice Mayor Reese, and they have been a tremendous support through this entire effort. And their continued support and continued vigilance with working within their cities is tremendous. Please heed their advice. They speak from the heart. They're experiencing this personally, both individuals, and it's challenging, and we understand that, and we hear it here at the county. And I want to assure everybody that's listening, Washoe County has never closed. I have been working 7 days a week for the last 6 weeks. I am committed to small businesses. I'm committed to the community. I'm committed to my fellow colleagues at the cities and the counties, and also at the state. We are going to endure this together. We have always endured this together. We're going to continue to bring out plans to ramp up testing, to make sure that we have ample contact tracing through our health department. We are going to do everything we can to make sure that we remain a strong Nevada and also a really strong Reno and a strong Sparks. I am dedicated and committed to you, and I will assure you that I am not going to stop until we find some sort of semblance of a new normal when we can reopen and reconvene. But until then, as Mayor Smith said, and Vice Mayor Reese, this is not the time to stop. We need to continue to be vigilant. Please wear your face masks when you're in public. Please practice safe social distancing, and please practice, the safe hygiene. And realistically, we can do this together, and I'm just asking for your help. Thank you.
Thank you, Mr. Chairman, and thank all of our media partners and those that participated. We intended on having these pressers 30 minutes, and they've gone well beyond that. Thanks largely to the generosity of our guests, as our elected leaders have provided a lot of their time today. This press conference is being recorded, as you know, and will be on our regional website, covid19washoe.com, in a matter of just a few minutes. So if you need to replay this for your reporting, you are certainly welcome to do that. That's all we have today. We'll do this again on Monday, May 4th, 11:30, starting with the Health District. We may have a leading speaker at that time. I'm not sure who that will be. But again, thank you, everybody, for helping us spread the word and keeping our community safe. Have a wonderful weekend.
Thanks, Adam.
Thanks, you guys.